There are renewed concerns today about the vaccination rollout to Indigenous communities, particularly those in regional New South Wales. It comes amid a positive case in Broken Hill, with fears of more cases there, as well as an outbreak in Dubbo and the surrounding region. To 8 p.m. last night, 178 Aboriginal and Torres Strait Islander people have contracted COVID-19 in New South Wales, and there have been 26 new cases in New South Wales in the last 24 hours, mostly in Dubbo. That prompted the federal government to deploy Defence and the National Critical Care and Trauma Response Centre's AUSMAT teams. And it comes amid renewed calls for a faster vaccine rollout campaign to Indigenous communities. Pat Turner is the Chief Executive of the National Aboriginal Community Controlled Health Organisation and joins me now. Welcome to the program.
Thank you very much, Dan.
Pat Turner, what's your assessment of that immediate situation in Western New South Wales?
Well, it's very concerning because in the past 24 hours, the 26 new cases in New South Wales with 24 in Dubbo, with the average age of those who've contracted COVID-19 was 24 years old. So I'm really concerned about the impact it's having on our young people, and I implore you all to please stay at home. Do not go out in the community unless it is absolutely necessary to get tested or vaccinated or to see a doctor or to buy essential food and goods for the house.
So it certainly appears that the age is trending younger everywhere. 24 there you mentioned. Earlier we heard here in the ACT, 19 and a half is the average age. Do you have a sense of what this will mean for your constituency, Aboriginal and Torres Strait Islander people?
Well, it's generally the older age groups, over 45, that start to develop chronic health conditions. So I'm hoping that these younger people don't have the level of comorbidities that our older groups do have, because, they are a real worry, which is why, we've been a priority group in Australia to get the vaccinations. Now, AstraZeneca has been out in the clinics for quite some time, but people really became very hesitant about it when there was all the publicity and mixed messaging from leadership, not our leadership, but other leadership in the country, about the blood clotting. So everyone got fearful, and people didn't want to have it. They wanted to wait for Pfizer. Well, Pfizer's rolling out daily increases of Pfizer vaccines are being distributed out into Western New South Wales, and I'm very pleased about that.
Go on. No, go on.
So we have a hookup every day with AH&MRC, which is our affiliate in Sydney, the Health Department in New South Wales and the Commonwealth, to discuss the vaccine rollout and any other additional requirements. So, for example, we're working with the Kirby Institute and the Department of Health to increase access to the point-of-care testing machines, and we're hoping to ensure that that goes to Dubbo, Burke, and one of our services, Murray Mar, that will receive access. Additional access to point-of-care testing, which is very important, because you've heard probably already today how long people have been waiting for their test results. So the Gen Expert machines that 83 of our ARCHOs across Australia have had in place since the beginning of COVID, with the cartridges to test for COVID. So we're just increasing that a little bit more out to Western New South Wales.
Pat Turner, you mentioned there about vaccines. I understand you have an update on the number of Aboriginal and Torres Strait Islander people that have been vaccinated across the country.
Yes, I do. So as of the 18th of August, 15,618, just for Aboriginal people, sorry, that's the Australian one, 175,100, 31.3% of our people have received at least one dose, and as of today, and 91,000 579, 16.4%, are fully vaccinated. So that's across Australia.
And we've seen reporting out from The Guardian today that there are some jurisdictions that are doing very well, particularly in Victoria, others, Western Australia and here in the ACT, that are not doing as well. What do you say then to the political leaders in jurisdictions that aren't getting it done that quickly?
I would say speed it up, please. Well, look, we do know that the vaccine rates are higher in the Kimberley, and we know that there's a problem with the data. So that's getting sorted out at the moment, but they've been very active, and they're going to hold a vaxathon in Broome for everybody to come forward to get vaccinated in a couple of weeks' time, in conjunction with RFDS and the Western Australian Health Authorities and CAMS, our Community Control Service in Broome. But Broome ran a clinic, Broome AMS ran a clinic on the weekend, and they had 85 people come forward on Saturday. So that was good. And of course, places like Maningrida and so on have really stepped up to the mark and got everyone vaccinated. So we really need all of the state health authorities to be working in partnership and collaborating with our community-controlled health sectors and making sure that they have the constant supply of the vaccine, because our children are eligible from the age of 12 to get vaccinated, and we need all of our families vaccinated because of the unnecessary, ongoing, overcrowded housing that our people still have to put up with in Australia today, Dan.
Yeah, Pat, you've talked a lot about community responses, and I wonder if that Vaxathon is a part of that. Because earlier this week I was talking to Denise Bowden on Yolngu country up in Arnhem Land, and she was saying that there's a call for a greater communication around the vaccinations to avoid, as you pointed out a little earlier, that hesitancy that we saw when there was confusion around the blood clotting issue. Do you think that more needs to be done around the communication and specifically to different communities in the nation?
Yes, I do, and I think that MeWatch is the health service in Nhulunbuy, Yirrkala, that services those communities, and MeWatch has got to get the messaging right. All of our ARCHOs have had resources made available to them to do the comms and get the messaging targeted to their population. So, I would want to see that continually upgraded to make sure that people are getting the right factual information. And but social media hasn't helped at all with all the anti-vaxxers and all the myths that are out there on social media, and I think that's been very irresponsible.
And that's the responsibility of everyone to call that out. Pat Turner, CEO of NACCHO, thank you so much for the update. Great to chat with you today.
Thank you, Dan.